Hello and welcome back to the Anti-Aging Hacks podcast. Today, my guest is Dr. Sue Ojageer, who is an award-winning pharmacist with over 15 years of experience in the healthcare industry. She's an advocate for holistic health and precision medicine with a doctorate of pharmacy from St. John's University. Serving the Dallas-Fort Worth area, Dr. Ojageer is the founder of PharmSue, a revolutionary concierge health practice. Would you like to get thicker, fuller, and stronger hair? Then make sure to check out fullyvital.com. The team's come up with fantastic and natural products that help rejuvenate your hair, but also delay and reverse gray hairs. So if you're interested in better hair, go to fullyvital.com and use the code anti-aging-hacks for 15% off your order. Are you enjoying the shows on this channel? Then please make sure to hit the subscribe button down below so you can get notified when we release new episodes. Our goal with this show is to help you and give you practical tips that you can use to slow down and reverse your aging so you can live and feel younger and live your best life. With that said, let's get on with the show. With that said, welcome to the Anti-Aging Hacks podcast.
Thank you so much for having me. It's a pleasure to be here.
So this is the first time I've had somebody who's worked as a pharmacist to come on the show, and so I have obviously some interesting questions for you. But just to get started, tell the listeners, how did you get into pharmacy? What is the school process like? How long was it? And what did you enjoy what did you enjoy the most as a pharmacist?
Absolutely. Truthfully, I'll be honest, I wanted to be in the medical profession, and being of my background as a West Indian American, I knew that medicine was always going to be somewhere in the future. The thought of becoming a pharmacist and not being on very invasive patient care, not, having to deal with patients and blood and being intense, pharmacy was a great option. Then vaccinations rolled around, where we were the hotspot for vaccinations and giving our patients care in the pharmacy. But honestly, it was the most rewarding part of becoming a pharmacist or choosing this profession was being the most accessible healthcare profession. You could honestly just walk into a local pharmacy, ask your provider behind the counter any question and get results or get answers. Instead of going to the ER or going to a doctor's visit, you have a healthcare professional at hand. So that idea and growing up with that notion of having someone available and serving our community was the honest, true reason that I became a pharmacist. I went to school at St. John's University. It was a 6-year program, and I enjoyed it. It flew by so quickly, and the years was just, it's been absolutely amazing. I practiced mostly in the retail setting in a community pharmacy at my local Walgreens. It's been about 14 years since I've worked there, and I built out my concierge practice, Pharmacist, and that's where I'm primarily working now.
Okay, great. Yeah, very interesting backstory. Obviously, thankfully I don't go to the pharmacy very often. I don't get a lot of drugs, and so I have very limited contact with pharmacists, but I also know that they're educational when you go to Walgreens or CVS or any other pharmacy in your hometown or country, then a lot of people rely on the pharmacist to answer questions about which medications to get, but also like what to pick from just the store itself. There's aisles and aisles of products, and sometimes you seek recommendations on, things that you might need to get for your health conditions, or if you have acid in your stomach or whatnot. Those are some of my limited interactions with pharmacists. But what is the job of a pharmacist on a day-to-day basis? What does it entail? Or is it a 12-hour shift? And then what are most people coming to you for? It's not for questions, it's to pick up their pharmaceuticals, right?
Well, most of us are familiar with pharmacists who work in the retail settings or just the hospital setting. Not many of us are familiar with the many different ways pharmacists could practice outside of those settings. So I'll go into detail in explaining exactly what a typical retail or community pharmacist looks like. So they work in your local Walgreens, CVS, or independent stores, and they basically process your prescriptions that you bring into the pharmacy or get faxed over or emailed over to the pharmacy. They fill the prescriptions after they're billed to the insurance, and they prepare your medications and dispense it to you when you come to pick it up. And during that time, you ask your pharmacist any questions that you may have on the medication. They go over any side effects, going over interactions with the medication, and basically tell you how to use it and what to expect when you're taking these medications. So that's our common ways that we interact or know what a pharmacist does. And in that setting, now there's hospital pharmacists will work with more clinical base with your physicians and go on rounds and help with your dosing of certain medications and fill prescriptions within the hospital setting. Those are the common areas that we typically know of a pharmacist.
So what I want to do is maybe like let's talk about the different decades of life and what are the most common medications people get. I assume that people in their 20s are
Mhm.
probably getting like something that's very acute that is not a chronic condition medication, right? So what, in your experience, what do people in their 20s get the most from a pharmacist?
Depending, I would say, honestly, it depends on the area where you're living and what's common in that area. For the Dallas area, I would mostly have seen, sadly, antidepressants being prescribed or that's one of the higher numbers of prescriptions that are filled. The younger generation, preteen to early 20s, I would say that would be ADH medication that has been
Hmm.
on the rise as well, and antibiotics also. Those are the acute fills. And you don't see that many common chronic care prescriptions that are being filled, like hypertension, diabetes. Slowly, that starts to gradually increase as your age does increase as well.
So you said ADHD or ADH, depression medications, antidepressants are the number one,
I do
and then
see
antibiotics?
that. Yes,
That's insane. I
it
would have
is.
never guessed.
It is, and that's honestly one of it's sad when you think like a younger person going through depression or anxiety, those common conditions, and those are one of the specific groups of patients that I do focus on helping get them to help them select the medications based on their genetic, because genetics plays a component in breaking down certain medications, and
Yeah.
not everyone processes medications like we expect it to. So it does have a very big genetic component in making those medications work.
Okay. Yes,
Mhm.
I agree with that, how you break down or process or synthesize a medication in your body. Okay, so that's in the 20s, which is shocking to me. What about people in their 30s? What are the most common medications they're getting?
It starts to increase to diabetes medications, hypertension, cholesterol.
In their 30s,
It,
all three of those.
it's been
Eh,
on the rise.
Okay, and are there obvious signs?
Mhm.
And for example, let's say somebody's coming for diabetes or hypertension. Can you look at that person in their 30s and say, maybe you might be a candidate? Or are these even like skinny, healthy looking people that are coming to get these medications?
Can't tell now.
You
Now
can't
it's
tell.
someone could look completely healthy on the outside,
Yeah.
show no symptoms, and that's why they're often called the silent killers. So making sure you're doing your proper screening, following up with your physical, leading a healthy lifestyle, very crucial, even at an early age.
Okay, wow, interesting. Okay, so let's progress now. People in their 40s. So 40s when it's kind of like a point in your life where you start to see in your 40s, people will see something or the other, some kind of health condition or problem. I'm not saying most people or all people will, but many will. And so when it comes to 40s, what is the number one thing? And yeah, let's just start there. I have many questions about that, but what's the number one drug or number top three drugs that people are taking?
A lot more of the antibiotics for long-term treatments of disease states, and
Antibiotics, okay.
still the rise as well with hypertension medications, diabetes, because oftentimes when you think of it, it's they're silent killers in a way,
Hmm.
but you don't really know if a medication is truly producing a result. And sometimes these patients stop taking it because they've taken it for a number of months or a couple of maybe a year or two, and assume that if you just stop taking it, you don't need it anymore. But in turn, you do keep following up and making sure you continue to take your medication as prescribed.
Yeah, my my mom does that. She just stops taking the medication, and I'm not sure why. But I think there is a tendency for a lot of people to
Yes.
consider that
Mhm.
when they're taking medications that maybe, they should either dose it down or try to stop it because this is not good. But also you got to change the underlying conditions, which is hard to do because, the Western medical system is about, okay, you have diabetes, let's give you metformin to tackle the diabetes, but we're not going to go after the root causes, which is help you eat healthier, maybe exercise more. Yes, you can say that in passing, but it's not really something that patients are being held to,
Mhm.
as opposed to getting the drug, and that's supposed to solve the problem, right? And we can talk about heart disease and others, as well, where it's some aspects of that the patient could control. I'm not
Mhm.
saying all, but I think the emphasis is more on, okay, how do we give you something that is proven to work, and it's a medication that you have to take for the rest of your life. And
Mhm.
that, I think, talking to many folks, that's what scares them, is that they have to take it for the rest of their life. But also, are there any long-term side effects? Because when they do see the advertisements for some of these medications, there's always the risk of injury or death, right? You're like, okay, I'll
It
take
is
it, but
it is
but
very scary, and that's one of
yeah,
the reasons many of our patients decide not to continue taking it. That's one of
yeah.
the things, the side effects that they go through. And you're
Hmm.
completely right with the importance of understanding the lifestyle effects that you need to implement, as well as taking the medications, are not stressed enough
Yeah.
when counseling our patients. So there is a number of patients that need to be educated properly on all the other things you need to do in addition to taking the medications.
Got it. Okay, so now let's get into the next 2 decades. Let's talk about 50s and 60s together.
Mhm.
What do you see most people taking? What are the common ailments and what are the common drugs that they're taking?
I see still the increase with um, pain medication, because now our older population has a lot of more aches and pains, joint pain, and a lot of pain medication is prescribed. And a lot of times they don't know how to communicate that to our prescribers or their physicians, and they sometimes blanket prescribe an overly prescribe some pain medication, which is very, very dangerous for our elderly population. Very much so, because of the way they metabolize those medications and they can build up in their body.
Mm,
Mhm.
interesting. Okay. So pain medications gets added, but all the other conditions are still continuing. So they have the
Right.
antibiotics, like you said, the hypertension, the diabetes medications, those continue. What about heart health medications? Are
Mhm.
they also added on in these decades of life?
It's yeah, definitely, because it always comes in a factor of 3, the hypertension, diabetes, and cholesterol.
Hmm.
Those are the 3 that you have to watch as you age,
Yeah.
depending on your food, lifestyle factors as well. And once you get your age increases, you will have a number of other conditions and things that you have to monitor and stay up to date with. And once you add more medications like pain medications on top of that, it becomes a little bit more difficult for them to manage.
Hmm. Got
Um,
it. And I guess let's round this out. Let's talk about 70s and 80s as well for folks in there. Again, many of them are very active. Many of them are walking around, even driving. So they are members of society. They're contributing in every way possible, maybe
Mhm.
out of the workforce, but still out and about. What do you see are the common ailments that they have, and what drugs are they taking?
A lot more times it's in the older population. I would say depression medications, dementia medications, memory loss is big, and you
Hmm.
have the same with the pain medication, together with that, in
Okay.
addition to everything else with the previous ones that we spoke
Yeah, so
of.
they just keep adding. So, okay, let me ask you this. In their 70s and 80s, what is the an average number of medications that somebody might be taking?
It's 10 and above.
10 and above.
Above. Some of my patients that I have personally helped and seen started off with almost 20 medications.
Oh my
And
God.
the bad thing is they don't even realize or know why they're taking half of these medications. It's just they've been compounded and just been added on to in their profile. And they
Hmm.
just take it and they just keep on going. And a lot of times there's like acid reflux medication, which is as soon as you go into a hospital, that's the first thing they add on. And that interacts with a lot of different medications, and it just stays in their profile and stays there forever.
Okay. I'm gonna go
Mhm.
off on a little tangent here. Why do they add acid reflux when you go to a hospital?
So a lot of times when you go to the hospital, you're sedentary, and that could cause medications to have an upset feeling in the stomach, like most of the side effects that you experience. So they give you that medication to help with that symptom. But when you come out of the hospital or you don't really have that, it still stays on your profile, still stays a part of your regimen, and that changes the stomach acid of the way your body produces acid in the stomach. And that in turn has an effect of the way the medications break down. So it doesn't completely work or help with the other medications that you're currently going to be taking or later on taking.
Got it. Okay. Okay, so I'll ask you one more question, and if you don't feel comfortable asking, let me know. Are the dosages that are prescribed for most medications for most people, are they the right dose or they're just the dose that's made by the manufacturer and
Mhm.
that's what you got to do with? That's what you got to deal with. For example, let's say there's a 100 milligram dose. Let's say a drug is sold in 100 and 200 milligrams, but the patient maybe doesn't need the full 100. Is there a way for them to take less, or the pill is what the pill is and you got to take the 100 milligrams?
That's a great question. And a lot of times it's because prescriptions are prescribed most commonly with what the practitioner is familiar with. If they're commonly being prescribed 100 milligrams and that's a dose that they commonly give out, are they
Mhm.
seeing effects showing results with their other patients? That's the dose that they're going to start off with. And you
Okay.
usually start low and then work your way up. But this is where you get into the other part of where genetics plays a part of where the medications could be having a result or not having a result. A lot of us either break medications down too quickly or too slowly. Depending on how we do that in our body, we could either have a great response to a medication or have no response at all. So there's no way for me just looking at you and I could tell like you'll do really good at XYZ at 100 milligrams. It's a
Mhm.
lot of time trial and error that we do prescribe when we give our patients medications. And having that inside look helps a lot of knowing how to adjust certain medications or what class we should stay away from, or this particular medication wouldn't really produce a result. So that does help a lot than having those factors ahead of time to know.
Great segue again. Let's talk about that. The genetic aspect of, the drug breaking down in your body and working or not working. So, how old is this science? What do we know about it? Why aren't more practitioners using genetic tests? And what do you see as the future with genetic tests and medicine?
Mhm. So genetic testing, in part, it works together and a whole based off of that's one component that you should use while prescribing medications, along with the renal function, your kidney function, the way your liver metabolizes the medication, which is through the genetics, and your age, weight, all of those factors should be taken into consideration when dosing medications. But specifically in genetic testing and having drug genome interactions, for example, um, I'll give you a prodrug. A common prodrug that we have is codeine. A lot of times, not everyone is aware that certain medications, such as pain medicine, has to be broken down or activated by the body with a certain enzyme. I might have the enzyme and I'll do great with it. I'll break it down. It'll produce the active metabolite of that drug and produce a result, and I'll have my pain relieved. You, for example, might not have that prodrug, that the activator to release that medication, and in turn you'll need a higher dose or that medicine won't work. And then sometimes we come across this hurdle of just labeling like that person's becoming addicted to it, or they're not breaking down, they need
Hmm.
more, or they're not able to use the common dose that's commonly prescribed, so they need more, they need something else. And they honestly sometimes get mislabeled as being addicted to something when they're truly not, and not because they're able to break it down. That's one of the
Wow. Interesting. And so let's just say a general person that's not very health oriented comes into the pharmacy, gets a prescription for 100 milligrams of some pharmaceutical. They go home and they try it out and it doesn't do what they want it to do, like take the pain away. And so maybe they might increase the dose and that kind of helps them and they triple the dose and that really helps them. So for them, they want the pain to be gone. And so they're probably going to be taking higher doses of the medication or even ask the doctor for higher doses. Then the doctor probably in the absence of genetic testing is going to say, sure, you can take more, right? And here's some warning that you should consider, but they want the pain to go away. So this is a really good point. The average person doesn't have any idea of how to figure this out on their own, and the doctor is not doing genetic testing. So what is the way forward? Like how should people be thinking about this?
I say to all of my patients, regardless of what medication you're taking, it's a good baseline to have some a basic understanding of where you stand with certain medications and the way you're going to process it.
Mhm.
We don't always intend for us to take any medications. The perfect world would exist. Don't take anything because you want to treat it naturally or help naturally with whatever you could do. But if you do eventually need to take medications down the road, at least you have something to refer to, or you could give your patient, your physician something to use as a baseline information.
Got it. So when we talk about genetic testing, are you talking about testing the entire genome, which is quite cheap to do now? I think it's $200, or are you referring to something else?
So they do have very extensive testing, what goes into the nitty-gritty of all the genetic, the alleles and the specific mutations that you could study.
Mhm.
So it constantly evolves. So it's always good to have some labs, they offer genetic testing where they could have it on file. And once research and more information is developed or found, they could always update your results or have that on hand to
Mhm.
update findings there.
Yeah, it would be really cool to have, like, for example, 23andMe did that because when you go to 23andMe and you log in and you've given them your data, they will tell you all your risk factors. They will tell you what you're more susceptible to, and they've taken some data away. But presumably that could work in the same way to say, hey, you have these SNPs missing, or you don't have these alleles, uh, for example, and that is going to cause breakdown problems with these types of drugs. I don't know if it could go to specific drugs, but at least categories of drugs because they work with pathways. And so you might be better educated and your doctor might be better educated on what needs to be done. But then also educating the doctor is going to be complicated because they're very busy and
Mhm.
they're seeing no, I don't want to put words in their mouth, but they're seeing lots and lots of patients every single day. So for them to go and educate themselves on the genetic types and all the interactions, if it was done automatically for them, where they could upload both of these things and have recommendations in the screen in front of them, that'd be easy. But for them to remember or reference this on a manual basis would be pretty prohibitive, I would think.
Pretty extensive and very hard to implement that in your practice. And and you're absolutely right. Physicians are very busy. Think about the time we spend with them when we have our doctor's visit. We have maybe about 15, half an hour. We get to
Mhm.
speak and tell them everything that's going on. So having another test done and having this as a baseline, it's difficult to have that information. So that's where I come in with my practice and have that. I provide that information to them and give them the basic rundown of exactly how we should start tailoring our medications or what type of medications will work best for this specific patient. So
Got
that's
it.
how we implement this in the physician's office.
Got it. So you help patients figure that puzzle out, right? And so where can they go to find this information? Where can they go to say, okay, I want a genetic test, I want to understand my drug profile and what I can do to either lower my medications or change to different medications because I don't think these are working.
Things off. So you would contact me on my website, pharmaceut.com, and get all the information, reach out to me, and I would go through a list of all the medications you're currently taking. And it's a very simple test. It's a swab test that you swab on the insides of your mouth. It's sent away to the lab in about 14 days. An extensive report comes back, about 30 to 40 pages. And I
Mhm.
condense all of that information, make my recommendations, and we reach out to the physician and let them know like if anything needs to be changed or adjusted, increase, decreases, and we go from there.
Got it. Got it. Okay. That makes sense. So you are also willing to provide them some, I don't want to say act as their primary doctor, but give them some information that they can take to their doctor that can
Yes.
help change the prescriptions or educate the doctor on why this might not be the best drug for them.
This would be such an amazing service if we could have it in the retail setting, because I would see it there the most. You see so many patients going to the physician and filling a prescription for an antidepressant, one specific SSRI, and then
Mhm.
6 weeks later, they get a new prescription and they tell them to stop taking the other one, try this one. And they go back and forth, and it's just a balancing game of trying to find the right one. And these poor patients are going from high copays to things not getting covered, prior authorizations being needed, and
Yeah.
going through that hassle. And they get so frustrated and just give up after some time. And you
Mhm.
see the struggle there firsthand, especially in that retail setting. But it's so hard to implement there. So starting off with the physicians where it's being prescribed is your best bet.
Yeah, because talk about doctors having 15 minutes with you, the pharmacist has 49 seconds with you
Gosh,
because they're
yes.
just running it, right? They're like, okay, here's your medication, here's your card, bye, thank you. And there's 10 people in line.
Drive through the phones,
Yeah.
everything.
Oh, yeah, their drive-throughs are full. Yeah, it's crazy. That'd be hard to do at that point of sale as well. Let me ask you a question about generics. So there's these drug companies, and I've consulted with at least one or a couple, and they spend billions of dollars to come up with a drug.
Mhm.
Either it be a traditional drug or a biologic or other drugs, regenerative. And it takes a lot of time and effort because a lot of drugs that they think are promising candidates actually fail trials. So I understand that it takes a lot of effort and you have to prove efficacy and safety and efficacy in that order. Then they have a patent on the drug and it's expensive for the next, I think, 20 years. And so what can people do to save money, especially when the drugs are off patent? Should they
Mhm.
buy the generic? Should they still keep buying from the company, which might be more expensive? What's your recommendation?
Generics are a great option. I always recommend to our patients who do have that high copays, deductibles, and some of them are very set in their mind to always get the brand name.
Yeah.
It's just thinking brand is like the better choice, or just that option is always the best. And don't get me wrong, there's some medications that you do need to stay on a specific brand when you're taking. For example, think drugs in a narrow therapeutic index, meaning that you can't switch back and forth from brand and generic. So if you are taking a generic and you've been on it for a number of years or it's doing well for you, you want to stay in that specific um, brand or generic. For example, like their thyroid medications or warfarin or Coumadin anticoagulants. So those shouldn't go back and forth between. But if you do have an option to choose between a generic and it's going to save you, I always recommend it to our patients.
Got it. And so when the person that's picking up, because the doctor's already mailed in the
Yeah.
medication that they got to pick up, right? The office has, not the doctor. Person comes in and they see like they have to pay $90 or $290, let's say. And at that point, can they say, hey, Miss Pharmacist, can you please swap out this expensive one for a cheaper one? Is that possible for you to make that determination, or does that have to come from the doctor?
So depending on what they write on the prescription, if they say to dispense it as written, or if they put a certain code on the prescription, we can't automatically do it. But if they don't say or have any stipulations to only restrict it to a certain brand or generic,
Mhm.
then switch it out to help our patients save
Okay.
on the medication.
Okay. Outside of the narrow conditions that you said, the generics might not be the best. You want to use the brand name or switch back and forth. Are most generics exactly the same as to how they work inside the body? So there's no difference?
So the active ingredient is the same. So this is where you get a little tricky now and having your patients say, well, I've been taking this brand or this generic and it's not doing anything for me. It's not working. I only want the brand name. So they often write it off as not being effective because of the excipients or the other components that make up the medication. Those could vary, but the active ingredient itself in there is going to be the same, but sometimes patients don't always agree with the other fillers in the medication itself, and that could be possibly causing a side effect or causing them to not have the best reaction.
I got you. I got you. Okay. So it's not that these drug manufacturers are saying, based on genetic tests, 10% of the population may not be able to synthesize this drug. So let's add this additional enzyme into the drug itself so everything's good. It's not what they're doing. It's just different excipients that are being added to the drug to make it maybe more available in the body. And some don't agree with people.
Exactly. So think about it. When you have a certain weight of the medication, it's probably 0.5 or 1 gram of the medication of the active ingredient. You need something else to hold it together in a
Right.
tablet form or put into the capsule. So you need like a powder or filler. So those other things in there, that's what the difference could be between manufacturers.
So that's 99% or more filler and
Mhm.
like 1% of the active ingredient.
Basically.
Okay. Okay. Yeah. Because the tablets are big and I'm like, there's not that much active in there. Okay, got it. So then, let me ask you the other thing. The biologics that are now being made by some companies like Amgen Bio, I think
Five-
Life Science. I don't know what the Amgen's name is anymore, but it's a life sciences company. It's a biotech company. And so the biologics, are they different than other drugs? Because they're not a tablet, correct? How do they work?
Similar, same thing. It's how do I explain? So it's just more of the active the active part of that where the biologic is there, it's going to be the same,
Mhm.
similar. So it's a biosimilar because you can't exactly replicate it to be exactly the same. So that's the active part that's in there. So they're able to get a biological similarity, biosimilar of that one.
Got it. Got it. Okay. So another tip I thought of for saving people money as they're listening to this podcast is, let's say you go to your doctor and he prescribes you 100 milligrams of certain drug. Could you then at the pharmacy say, hey, doc, can you make it 500 milligrams? And I'm just going to use a pill cutter to
Yeah.
cut it into, 1/5 and take it every single day. So I save 80% of my costs. Is that possible to do and recommended?
So how big of a tablet are we talking here? Because sometimes these tablets are very, very tiny, and having our patients go through all that hassle and thinking to cut it, it's not always going to be perfect, and not every medication is going to be scored to be cut 5 times. So
Hmm.
that's you're not gonna get an active or equal amount of medication within those different pieces that you're gonna cut out. So that's not a really good recommendation. If it's like a half or like a pill that's have a score in the middle and you could cut it and break it,
Hmm.
and patient titrating up or down on a medication, then to help, transition to the next dosage, then it's recommended at that time.
Okay, so
That's
maybe
my
don't cut it in five, but possibly you could cut it in half.
Mhm.
Okay, so you could save, and I would assume that the 100 milligram and the 200 milligram of the same drug don't cost double. They're a little bit more.
Hopefully not, no. That's when we
Okay.
get into deductibles and co-pays, and one thing to mention as well, not all medications should be cut because some of them have a coating or some of them are enterically coated.
Yeah,
What it's designed to release at a certain, area in your stomach, and that's where the stomach acid that we spoke of is important because it has to be released within the intestine or stomach, and if you ruin that coating, then it's not gonna work properly.
got it. Got it. Got it. Yeah, so you have to be this has to be specific. If it's dry tablet,
Yeah,
then possibly you can cut it, but all the other types, you have to be very careful.
and
You
it'll
they
tell
might
you there on it, like,
they'll
you
tell
should.
you. Oh, so don't be sneaky as a pharmacist.
Yes, always
Okay.
ask your.
Don't be like, I'll cut it at home, don't you worry. And then, you're not doing it right.
Don't get
Okay.
the 8 ways.
Yeah, don't cut it anyways. Okay. Are there any other tips or tricks that pharmacists know and maybe smile about or smirk about in the back room as they're serving their clients or patients that normal people have no idea about?
I think the biggest thing, not spark or just we get quite often, especially in the retail setting, is why does it take so long to fill these prescriptions? Because, when you think of it in all actuality, it's just literally putting a label on something or box or counting out 30, 30 tablets. Why does it take maybe half an hour or an hour on a good, well-maintained, steady pharmacy?
Hmm.
And that's on the lower end. Sometimes we have wait times up to 2 hours, and that's an often quite a lot the question or response that we always get. And it's because of the insurance process that we have to go through. We have to bill the medication, we have to fill it. And surprisingly, when you walk into a pharmacy and you see no lines or it looks quiet, it's never quiet. There's a number of things that's happening before that. You have a queue full of patients that has to be filled ahead of time, and they have a certain time that it has to be taken care of. So it's not always 10 minutes you'll get something out in a blink of an eye. So that's
I
an
got
off
you.
see. And our questions on the deductible are the co-pays and medications. A lot of time patients think that we just pull the number out of random air or just decide to charge you a certain medication price for their prescription in particular, but it does go through a process of getting adjudicated and processed with the insurance and getting that return. And it's determined by the insurance company, not by the
Yeah,
pharmacy.
fair enough. As mad as you might get about some of those numbers that you're paying, it's not the pharmacy. I mean, the pharmacy is making its cut. There's no doubt about that. But still, like the drug makers are the ones that are making the bulk of the money. So I totally agree with you. And thank you for sharing. I know the pharmacy is constantly worrying, like
Mhm.
working, and there's things going on, even though you can't see them.
Yes,
Certainly because they're filling so many medications. The
there's all.
aisles are always full within the pharmacy. It's like just stacks and stacks of medications. Okay. I guess I'll ask you one other question about the opioid crisis that's roiling America. There's all these news and headlines about opioids are out of control and they're killing so many people. What have you seen on the front lines regarding the opioid crisis?
I see it very often, and sometimes it's hard to paint a picture and say that this particular group or class or any specific or label it to a certain ethnicity, but it could affect anyone. And you have to be very vigilant. You have to be there to help our patients and help them to understand when they are going through any ailments that does require a narcotic, that they're educated on how to know, or their family members are able to see if they're going to have addiction or issues. And it's always certain medications, for example, Narcan is given often with, or should be given often when an opioid is prescribed. And that's where you always want to make sure you're filling all your prescriptions at one pharmacy, so your pharmacist is able to see your medications that you're taking. So don't go back and forth to different pharmacies, or they're able to see your complete profile. There are
Hmm.
systems now that are built in place where you could see this information online as well. But having that relationship with your provider, your physician, and your pharmacist is very important, and helping to understand that and know how to manage it.
Got it. Got it. Okay. Thank you for answering that. Finally, you've got a mentorship program for other pharmacists. It's called the Pharmacy Mentors, and looks like it's one of the more successful things you've been doing recently. So tell us more about that and how it came to be.
Sure. I started this as a fun project. I I did write a children's book, and the children's book evolved, and the second one that came about was a coloring book that came from that project that stemmed away. The first one was more of a STEM related um, publication that I did with the kids, and then it became a fun project to do in the pharmacy world. And that time when I published that coloring book, it was coming up on my 15-year anniversary of graduating as a pharmacist, and I wanted to see exactly where I stood in the profession, of knowing like connecting with my peers, or see what they're practicing, what areas or what fields they're working in. And very surprisingly so, I was able to connect with a number of different pharmacists across the profession that I didn't know even existed. I was always familiar with pharmacists in the industry setting, in the retail hospital, the common ones that we think of when we think of a pharmacist. But to my surprise, there was pharmacists in all different areas. And that ignited a fire in me to explore that. Like, why wasn't I aware of this when I was in school? Like, you hear of it, but it's just left on the back burner, or you just kind of have to know your certain connections in order to get to a certain field. So it started off as a passion project from the coloring book. And I took the coloring book idea and put it onto a platform where you could actually connect with these professionals within the field and get guidance and mentorship from them. And I think
Nice.
it's a great resource for students, especially because if our students are exposed to this or know of this, it would be so amazing for them to get that leadership from our mentors and guidance while they're still in their profession, excited from it.
Mm. And so the guidance would be that how to either navigate the field of pharmacy, how to get jobs, or how to progress up their career. What specifically are they looking for guidance for?
Exactly what you said, to know what courses or what fields or what connections do I need, or what studies should I focus on, or do I need to do a residency? What specific residency? Who should I connect with? Is anyone, like, for example, there's a nuclear pharmacist, and I was speaking with another colleague, not in the medical field, and we were just discussing, I forgot how the topic came up, of nuclear pharmacists exist out there, and they surprisingly said, "Do they make nuclear bombs?" I'm like, "No, we don't make nuclear bombs," but not knowing that, or not being able to know that something like that exists, it's awesome, because if you know the person in that field, or you're interested in learning about radioactive medications and helping our patients, and that's something that interests you, would you not rather learn from that person that's working in that field, or get mentorship advice from them?
Yeah,
Well,
100%.
where
Absolutely.
you
That
learn.
if you're a young student and you're trying to figure out if, for example, that use case might be the one for you, talking to somebody in the field would be priceless, right? As opposed to searching, Googling,
Yes.
looking, going on YouTube or TikTok or whatever kids are going these Snapchat, kids are
Yeah.
going these days. But yeah, talking to somebody that's been in the field for 10, 20 years would be priceless because you can get a lot of information of how many jobs are actually out there. How do I get a job? Like, how long does it take to complete my education? Right? What does the career advancement look like? Yeah,
Exactly.
so great, great resource. I'm glad it's taken off, and yeah, just thanks for providing that to the community. I think that should be a resource in every profession that the children and young adults that are starting their career or in school still should be able to access or are able to access. So, with that
Mhm.
said, thank you so much for coming on the Anti-Aging Hacks Show. Any last parting words from the first pharmacist on this show?
Well, it's been a pleasure to be here. I've enjoyed our conversation. Hopefully, it does spark an interest to just go out to your pharmacy, just be patient with them if you're going to be filling your prescriptions at a retail setting, and to thank them for their services, for what they do and offer. And if you have any questions, always stop by. They are there to help and to provide assistance.
Okay, perfect. Thank you, Dr. Ojageer.